The majority of the literature that we have for a first episode of depression is that patients need to be on an antidepressant medication for 6 to 12 months at least. So, a reassessment of the patient's symptoms and response to the antidepressant is very important. And you can use the same measurement tool that you've used, for example, the PHQ-9 at the beginning. And then you can do that at 6 month or 12 month and see if their depression is in remission. And you really need to ensure that the patient verbalizes that they feel that their depression is in remission. The other variable that you also need to understand and factor in is a family history of depression, or whether this is the first, second, or third episode of
Hmm.
depression. Is this chronic depression? Are we treating a chronic condition that will require this medication long term, or is this their first episode of depression? And then maybe 6 to 12 months of antidepressant treatment is okay. And then you can talk to them about attempting to taper off the medication. And tapering off medications is different for different classes of antidepressants, but there are some medications where you could just flat out discontinue the medication. So, for example, I'll give a example: fluoxetine, the old name of
Hmm.
Prozac, could be discontinued because it auto tapers. It has a very long half-life. So you don't need to go through a taper off regimen. You can just stop the medication and it'll auto taper through several weeks, and then you can monitor the patient whether their depression continues to be in remission and whether you need any further interventions. And first episode of depression